congratulations to the newly formed Canadian Association for Global Health. My best wishes moving forward with your vision to create a healthier and more equitable world.
Congratulations to the Canadian Association for Global Health on your recent formation. Félicitations. Canada has a long history of engagement in global health, be it through research, policy, practice, or diplomacy. I wish the association all the best as you continue this tradition of helping to improve health and health equity everywhere.
Global health was very much about over there. It was international health and it was elsewhere. Today, it's everywhere, it's global.
In my over 10 years experience studying and working in global health in Africa and in Canada is the reduction in helicopter research and the recent discourse in decolonizing global health and anti-racism, which I think are very welcome developments.
L'évolution des projets de recherche et de coopération, davantage alignés sur le pouvoir d'agir avec nos partenaires. Les déterminants sociaux de la santé, faisant apparaître justement les enjeux d'équité. Et finalement, la responsabilité sociale qui nous obligeait en quelque sorte dans nos milieux académiques à nous aligner davantage justement sur les gestionnaires, les personnels de santé, les décideurs et la communauté.
Is that global health has gone from a forgotten and fringe issue on the margins of policy to a central dynamic mushrooming field that is occupying every policymaker, no matter where they are at the moment.
Over the course of my relatively young career, I've seen a change in the global health landscape regarding an increase in equitable learning opportunities for young people. And a great example is the WHO internships in Geneva.
Il y a eu d'abord les objectifs du millénaire pour le développement, ensuite les objectifs du développement durable qui sont venus donner une orientation assez globale et générale des indicateurs de santé et des déterminants socio-économiques sur lesquels les décideurs, les acteurs sur le terrain et les chercheurs devraient se concentrer. Ensuite, il y a eu la politique féministe de l'aide internationale qui est venue propulser dans l'agenda international la protection des droits des femmes et des jeunes filles. Et encore plus récemment, de façon plus globale, il y a le mouvement de la décolonisation de la santé mondiale dans laquelle sont discutées les modalités de gouvernance, les modalités de financement, les enjeux dans le partenariat Nord-Sud, des principes éthiques et de justice sociale.
First, a growing recognition of social health inequities, especially experienced by marginalized, vulnerable, and invisible populations. Second, a heightened awareness that political, commercial, environmental, and social determinants deeply shape the well-being and health of populations. And third, that global health practitioners, researchers, funders, and actors alike need to address the multiple intersecting societal power structures of privileges and oppressions such as sexism, heterosexism, racism, neocolonialism, ageism, ableism, classism, etc., which have severe impacts on population health, equity, and social justice for all, no matter where people live.
Les choses ont beaucoup changé, et souvent pour le mieux. Pour moi, le plus important de ces changements est le rapport qu'entretiennent les acteurs du Sud et du Nord. Ils sont de plus en plus égalitaires, bien que ces inégalités soient encore très profondes. Les deux maîtres mots de ce changement sont partenariat et renforcement des capacités.
Well, my dream for CAGH would be that the collaboration would be seamless between practitioners, applied researchers, community, and decision makers. That we listen to that intersection. We listen to what people are saying and what's the common language, what's the common alignment, and how can we move forward on those issues. And we need to listen with wisdom and experience, and those two things, wisdom and experience, need to be valued. And finally, the growth of young professionals, not just in Canada but globally, that they will be the next generation, that they'll be engaged, they'll be listened to, and they will listen.
Politics of global health is something that I think the association would be well positioned to deal with. Certainly has the membership and excellence to take this on.
To have a platform for hope and optimism.
To give more voice to LMIC decision makers and research users in its governance structures and decision-making processes.
Revêt de plus en plus d'importance. L'intérêt pour les changements climatiques et l'avenir de la planète mobilise la population de façon plus globale. La santé planétaire est un concept qui met en évidence l'exigence de solidarité qui ne peut être réalisée que par une réduction de toutes les inégalités, incluant celle de la santé.
Continue to foster global partnerships and to uphold equity, diversity, and inclusion. That wherever we find ourselves on the intersectionality spectrum as individuals, as communities of practice, and as researchers.
First is that it embraces diversity as our greatest global asset. Second, that it catalyzes opportunities to harness knowledge for health in true partnership with others. And third, that it unleashes a new leadership for global health through its meetings.
What I hope CAGH will accomplish in the next decade is to really bring to attention to those in Canada and elsewhere how much we are interrelated and how much we can support each other in developing improved global health research, global health policy implementation, and global health education.
The first is a dynamic, member-driven community that facilitates the hopes and energies and actions of its members, leading to an equitable and resilient world. I'd like to see this community in particular have lots of students and young professionals, and of course, partners from the Global South. I'd like us to be known for our track record in collaboration and our ability to promote and nurture synergies. This is because, in my mind, the context in which we find ourselves is still too much inward looking and with fragmentation. And third, I'd like to have us play a much stronger role over this next decade on what the recently published 2021 Lancet Countdown report, an unprecedented opportunity to ensure a healthy future for all. So that's in response to both the global health crisis of COVID-19 and of course the global climate crisis. I would really like to see the CAGH with every member engaged as a strong contributor to this opportunity. So I think if we can achieve these three things over the decade, I should be able to try to retire again.
Pour la santé mondiale dans les prochaines années, essentiellement de contribuer à réduire les brèches de santé, justement en travaillant sur des systèmes de santé publics, universels, basés sur les soins de santé primaires et traduisant véritablement un meilleur accès et un droit à la santé pour l'ensemble de nos citoyens du monde. Merci.
Is providing a clear, unified voice in Canada for people, community members, researchers, clinicians doing work in the field of global health with a clear health equity centered approach to tackling some of the most complicated issues that face our global community.
On behalf of the University of Waterloo Student Chapter, we want to wish congratulations to the newly formed Canadian Association for Global Health.
And congratulations from the Queen's University Chapter. We're very excited to see where the new Board of Directors takes the future of CAGH.
From the McGill Chapter as well, we're really excited for the new CAGH organization.
Alors, longue vie à l'Association canadienne pour la santé mondiale et excellente conférence à toutes et à tous.